What makes a happy, healthy person? What makes a happy, healthy society? Our practices, what we do, can tell us a lot about our own health and happiness. And Maya communities can inspire us to remember that we can define our own health and happiness every day through what we do together. I first started thinking about health and happiness when I was living in Santa Cruz, a Mopan Maya speaking village in the Toledo district of southern Belize. In Santa Cruz, I was part of a larger project that was tracing land use from the ancient Maya all the way through to the present. The team consisted of archaeologists led by Dr. Keith Proofer, climate scientists, ecologists, and social anthropologists led by Becky Zarger, and including myself. Now, as a social anthropologist, I was privileged and fortunate to be able to live in Santa Cruz, participating in daily activities, observing, and also as I was observing and practicing activities, I was talking with many different people, parents, grandparents, children. Now, because of my interest in health and happiness, those conversations often turned to that subject. And I was often found asking, what makes a happy, healthy person? Or in Mopan Maya, kuwichwalak o betikech timuganech. Now, I was thinking that the key to understanding health and happiness was to break down the distinction between health as this physical thing and happiness as a psychological thing. I was rejecting this mind-body dualism because I sought to understand health more holistically. Now, this isn't a very wild concept. A lot of people in a lot of cultures view health very holistically, but in the States and in Europe, where I was coming from, it was still a very novel concept. So I felt there needed to be more evidence that explicitly connected the mind and the body, or happiness, in health. So one day, I had a revelation. It was May, and May in Santa Cruz is a month of the year where many Maya communities plant corn. So as part of the corn planting process, people come together to work and to bake food and tortillas for the people who will plant corn. Now, I knew from Becky Zarger's research that skills in Maya communities, you don't learn from somebody explicitly telling you how to do them. You learn through practice. And I had practiced making tortillas, and by May, I could make a passable tortilla. And some people even said a pretty tortilla. So in May, my labor was valuable, and I was often called upon to help bake tortillas at many different houses. So it was this evening, I was at the third house of the day, and I was sitting on a low stool with my hands in the masa, trying not to fall asleep, overwhelmed with tiredness from making all those tortillas. And I suddenly became almost hyper-aware of what was going on around me. At the other end of the thatch house, the men sat playing the corn game. And the corn game is similar to sari or parcheesi. The men move their markers along a row of corn kernels that was on the mud floor. They move their markers up and down, and at the end of the row of corn kernels sat a bag of corn seed that would be planted the next morning. And next to the bag of corn seed, a clay incensario burning copal or pom. The smell of the incense drifted from that side of the house back to where I was sitting in the kitchen, and it mixed with the smell of the fresh tortillas baking on the fire hearth and the rich meal of pig intestines, liver, and lungs that was cooking over the fire. And I sat there rolling the balls of masa in my hand, and the low lights flickering from just a few gas lamps in the room. And that collision of like sensory experience and my tiredness, in that moment, I felt my body begin to change. Now, the next day, the men went to plant corn, and I went about my daily business investigating ecological heritage knowledge and health in the village, and thinking that health had a lot more to do with what people did, and oftentimes what they did together. So that event from the night before was more than just people gathering to work. It was solidifying social bonds. It was bringing together family and friends, and the teasing and laughing and joking during the game or while we were playing tortillas and teasing me about my tiredness. All of that was a social activity, and it struck me that social bonds are critical to a healthy, happy society. Now, I had been listening to people talk about what they did together for a while as part of my work in the village and surrounding Toledo district with TECHA, the Toledo Environmental and Cultural Heritage Alliance. Now, TECHA was a collaborative organization. Students, teachers, community members, organizations, the Ministry of Education, all coming together to figure out what would be the best ecological heritage knowledge, the most valuable information to put into the TECHA workbook, which is a workbook distributed throughout the Toledo district that had environmental and cultural heritage knowledge in it. Now, through my discussion with all of those players and the design and the teaching of this TECHA workbook, I figured out that heritage was not something that you could just list. It was not an interview you could do and find out all these traditional things and put them in a book. The heritage that was valuable was the heritage that was enacted in the present. So in this sense, heritage was not static, but it was made every single day through what people did. So women baked tortillas together, and men planted corn together, and children picked fruit together, and men built houses together, and women washed in the river together. And so heritage was in the doing, through what people did, and oftentimes what they did together, and it's the doing that was changing their bodies. So what then is the connection between this change in people's bodies and their health and happiness? Because where I'd come from in the States, people were talking about health and happiness in terms of better access to clinics, or health insurance, or health care, doctors, or medications. But this wasn't what I was hearing when I asked the question in Santa Cruz. Instead, I was hearing things like, corn makes us healthy. We get sick when we get lazy, and we're unwilling or we're unable to go out to the farm to work. So what exactly did people say when I said, well, what makes you healthy if it's not these other things? Planting corn, helping each other, eating bush foods make us healthy. It's foods from the forest. Hard work makes us healthy. Right? So all of these things together make a healthy, happy society. So I really was interested in this connection, right, between these ecological heritage practices and health, and how they were actually interconnected. And so I found that it was really very intrinsic, to the point where I could form kind of like a loop from what people told me, right? So if people were sick or they were unhealthy, they had reduced strength, they weren't able to work, they weren't able to enact their traditional heritage practices, to go to the farm, to bake, to do all of those things. And if they weren't able to work, then they weren't able to get those healthy bush foods or grow the healthy corn out in the forest. And if they were unable to eat those healthy things, then they would be sick. So in this way, health and happiness and traditional ecological practices are intrinsically connected in this kind of looping process. Now, as a researcher, I was really interested if I could take this to the next level and if I could find and quantify some of these relationships. So what I did is I designed a survey to measure both health and happiness and traditional ecological heritage practices. Now, I didn't take a survey from the States or Europe to measure health and happiness, because as we've just seen, health and happiness wasn't measured in the same way as access to clinics or doctors or medicines. All right? So I designed my own survey. I administered it across the village in Santa Cruz, and indeed, I found out that those families that scored higher in the level of engagement with traditional ecological heritage practices were also those families who scored higher in terms of health and happiness. Now, remember, when I say traditional ecological practices, I'm talking about how the people doing them define them in the present, that living heritage that I was talking about. So then I ran some statistics, and I found to see if I could find a model to predict health in this way. And indeed, I was able to find a model to predict health using 3 ecological heritage practices. Using food from the forest, so if people got their food from the forest, making sugar from cane in the traditional Maya way, and not working for wages. That means exchanging labor within the village and not participating in labor outside of the village. With those 3 practices, I was able to predict with statistical significance if people were going to score higher in their healthy and happiness scores. All right, so what can we learn from this? What can we take from this? Well, I think that what we can learn from Santa Cruz and the Maya communities in Belize and many Maya communities around the world is that health and happiness have a lot to do with what we do and who we do it with. So for the Maya communities I worked with, this means that access to the land, being able to plant, being able to go to the forest, harvest foods, to teach their children by doing out in the forest is critical to their health and happiness. And in that sense, requiring or suggesting that Maya communities follow trends toward private land ownership, follow trends to private resource management, it has the actual potential to compromise their health and happiness. Now, we might feel very disconnected from our ecological heritage. Maybe not that many people in the room, but some people may feel disconnected from our ecological heritage. But I'm here to tell you that you may not be as disconnected as you think. Coming from the States, I see people looking to the future as opposed to looking to the past, as opposed to the future for answers to their own health and happiness, doing things like community gardening or time banking or bartering. Okay, they're taking these sort of heritage practices from the past and recasting them and making them part of their present and feeling in control of how they feel in their own health and happiness in that way. I know, for example, in my house, I learned how to make spanakopita, which is a traditional Greek dish, from my aunt, and I've taught it to my son. Now, he doesn't use exactly the same recipe. He changes, has his own little tweaks, but that is my living heritage and changing through enacting and through doing. So I challenge you to find a heritage practice in your past and incorporate it into your present and see how it changes the way you feel, how it changes your body, how it changes your health, your happiness, your community, or even your society. Thank you.